Hi there, I'm Rosie Moore speaking to you from CosmetiCare in Newport Beach. I'm here today to talk to you a little bit about the science behind CoolSculpting. Wondering what cryolipolysis is? Well, it's a scientific name for CoolSculpting. CoolSculpting is a non-invasive treatment that uses a controlled cooling technology to safely freeze and permanently remove stubborn fat, allowing for fat reduction. The concept for CoolSculpting began with a frozen treat. In 1970s, two Harvard medical doctors observed a phenomenon. Children who loved popsicles actually were creating dimples in their cheeks. This was a first observation between the relationship between cold and fat. It was known as popsicle paniculitis. The doctors wondered if this side effect could be duplicated in adults for aesthetic purposes. The CoolSculpting treatment was born from the insight that cold could effectively and safely eliminate fat cells without damaging the skin or surrounding tissues. Zeltiq, the original home company of CoolSculpting, began offering the procedure in 2005 to medical clinics. Research began, it was found that targeted applications of a cold device could safely lower the body's temperature to that area to around 40 degrees. There was no risk of hurting nearby skin or organs. Over time, it was found that targeted cooling led to fat reduction of around 20%, and CoolSculpting was born. With CoolSculpting, there's no downtime. The patient receives treatment and can go on to their day-to-day activities. CoolSculpting is a great option for someone who leads a healthy and active lifestyle. Sometimes you get stubborn fat that is resistant to diet and exercise, and that's when CoolSculpting comes in. It's a great option. So what happens to the fat cells after your CoolSculpting treatment? Well, the fat cells crystallize and your body naturally eliminates them. Patients often ask, how much fat reduction will I get from one treatment of CoolSculpting? Typically, it's 20 to 25% reduction of fat. However, CoolSculpting is not a tool to lose weight. CoolSculpting has been FDA cleared to treat 9 areas of the body: under the chin, jawline, flanks, abdomen, inner and outer thighs, underneath the buttocks known as banana roll, bra area, upper arms, and back fat. When the applicator is first applied, you may feel a sense of pulling and tugging, sometimes a little bit of pinching. Some people have said they felt aching and a little bit of cramping. The nice thing to know is that after 5 minutes, all of the sensations subside. So my patients usually see results as early as, in my opinion, about a week. However, it's typical to see results in about 3 weeks. The body takes its time, and since the fat cells are crystallized, it does take the body up to 6 months to remove the cells. When one loses weight, the fat cells simply shrink in size. However, the fat cells still remain. With CoolSculpting technology, fat cells are permanently destroyed, offering fat reduction. Zeltiq, who manufactures the CoolSculpting device, will only sell to physicians and their medical staff who have undergone a stringent training and certification process. Hi Maritza, how are you? Are you excited?
Yes.
Do you have any questions about this wonderful procedure?
No, I'm just really excited.
I'm so glad you're excited about it because you're going to see some amazing results. So what I'm going to do right now is I'm going to put this gel pad right over the area. It might feel a little cold. And what this gel pad does, it serves as a barrier to your skin and the actual CoolSculpting applicator. Okay, I'll go on the other side. Now the actual treatment, because we're dual sculpting, is going to be 35 minutes.
That's pretty quick.
It's a quick procedure. When I apply the actual applicators, you're going to feel a little bit of sensation of pulling and tugging, a little bit of pinching. Okay, here we go. Do your left side first, and you're gonna just kind of just feel all that tissue just go right on in. And actually that is the worst part of it, okay? Was that easy? Okay, good. This is my favorite treatment. This is doing the back bra. That fat is amazing. That it's gonna look great. Let me start this machine. Okay, we're gonna go ahead and apply the next one, which is on your right side. And here we go. Are you doing okay? Okay, you're officially being dual sculpted. So we'll keep you on these applicators. The actual treatment lasts for about 35 minutes. And once we remove it, it's actually gonna look like a little bar of butter. And I'll give you like a 2 to 3 minute massage to just get that little area just nice and flat. And you might kind of feel just a little bit of numbness. Tomorrow, when you go to touch it, it'll just feel a little tenderness, almost like you got a bruise. Okay.
And is this as cold as it gets?
Yes, well, it'll get a little colder. The first 5 minutes of the treatment gets very, very cold.
Okay.
So right now what you're feeling is more of a vacuum pulling sensation.
Okay.
Sometimes it actually feels like a bubble, little bubbling effect. And so what the technology is doing, it's lowering that area that we're targeting to about 40 degrees. And that's when the fat cells, can no longer withstand that cold, and they start to die off. And then essentially they become crystallized, and you'll naturally eliminate them through your lymphatic system. So because you've decided to have CoolSculpting, what I usually recommend is continue your healthy and active lifestyle. It's really important for you to just continue that. You'll feel better, you'll get a lot slimmer as time goes on. You'll start seeing results as early as 3 weeks. Some patients I've seen as early as a week. But you'll see some beautiful results between 4 to 6 months. It takes your body that long to eliminate the fat cells.
And then what do you recommend, like wearing anything after?
So after the treatment, I usually recommend just staying hydrated. A lot of patients enjoy wearing a compression garment. Some patients, just do detox teas, or massages, just help your body get rid of those fat cells by just doing all of the above. Being a compliant patient is key. You definitely don't want to gain weight. You want to just stay at the weight you are, but sometimes having CoolSculpting just puts you in another level where you want to start just working out and losing some weight. Because you're going to see yourself in the mirror and be, oh, I like this. I'm actually glad you chose CoolSculpting versus having liposuction. Because with CoolSculpting, because your body takes a while to get rid of the fat cells, it really helps with people who are worried about skin laxity. And because it's very gradual, when you're losing those fat cells, your body tends to conform with it. In comparison to liposuction, when you just go in, or weight reduction, the actual procedure could be very invasive. Men and women carry fat, stubborn fat, in all areas of their bodies. Some people carry it in their flanks, some people carry it in their upper or lower abdomens. For men, typically they have what's called visceral fat. It's the beer belly, it's that hardening of the stomach. CoolSculpting cannot address those areas. CoolSculpting is best when you have the subcutaneous fat, fat that is pliable, fat that is pinchable. There's several applicators that could be used on the body for the reduction of fat in that targeted area. However, what's very, very important is getting a professional assessment by an expert that will tell you how many sessions you're going to need to get you to the desired results. So I'm about to take off the applicator, and what you're going to feel is just another sensation of just that vacuum and pulling. And then I'm going to just clean you up a little bit, and then we're going to start your massage for about 2 to 3 minutes, okay? 2, 1. Okay, so here we go. This is that beautiful bar of butter. And when you see this little line there, that means that your applicator was nice and full. What's very important is the massage immediately after taking off the applicator. It's shown to give much better results after giving this massage. Just kind of helping those crystallized fat cells, just helping it out, helping your body out, just to for it to just go through that lymphatic system. You doing okay?
Yeah.
How does it feel? A little sore?
Just a little. Not really bad.
And like I said, tomorrow you're going to be a little sore, all normal. Might be a little bit of inflammation. You will definitely not be bruising. And by the time you get down to your car, your skin's going to be back to normal. This pink will be gone. Okay, we're going to take off the other one. All right, it's my favorite part. You see that little line right there. And again, you're going to just allow your body to rid itself of these fat cells. I usually recommend to my patients that they get massages, drink detox teas, stay hydrated, continue your active lifestyle of diet and exercise. And some people actually really prefer to use compression garments. The reason being is because it feels better just to have that compression around, your back here, and it actually feels like you're actually shaping your back. We will see you back in 30 days for retreatment. Retreating the area when it comes to CoolSculpting is very important. You're going to lose between 20 to 25% of the fat cells every time you do a treatment. So again, I like to treat at 30 days. You can wait up to 12 weeks to treat, but why not just focus on those cells and get you the results you need. Okay, and you're all done. Thank you for joining.